Have you experienced pelvic pain or discomfort that you couldn't quite explain? Or have you found yourself dealing with other health-related issues down there that seem unrelated? This can often be a sign of a deeper and overlooked problem. I'm Hina, Sheth, pelvic floor therapist for over 25 years, and I'm going to share with you 9 signs that you could be dealing with issues related to your pelvic floor. And it all starts with one that you might be familiar with: low back pain. The pelvic floor is a group of 14 muscles located deep inside of your pelvis. They have attachments to the low back, to the sit bones, as well as to the pubic bone, forming a bowl-type structure deep inside of that pelvis. And these pelvic floor muscles coordinate with many other muscles of the body, including muscles of the low back as well as the abdomen. And these muscles are really, really important for low back stability and support. And therefore, if these pelvic floor muscles are tight or weak or a combination, they can create a tilt in your pelvis, either forward or backward or even in between the two bones. And when there is asymmetry inside of this pelvis, then it can create other issues related to postural imbalances. And those postural imbalances can end up causing excessive compression or excessive strain in the muscles and the joints of the low back. Number 2, constipation. People don't realize that these pelvic floor muscles serve an important role for many of the pelvic organs' functions, particularly having a bowel movement. You can see here that the pelvic floor muscles go through the rectum, and if there's any restrictions or tightness in these muscles, they can interfere with your ability to poop. Number 3, bladder issues. Now, this can range from everything from incontinence to feeling like you have a UTI all the time to even urinary retention. The reason why is because the bladder sits directly behind the pubic bone, and the tail end of that, known as your urethra, goes through the pelvic floor muscles. When that urethra has any sort of imbalance of the pelvic floor muscles, whether they're too tight or they're too weak, they can cause a whole host of issues, ranging from incontinence, your inability to hold back your pee, or to tightness and urinary retention. Number 4, hip pain. At some point, most people are going to develop hip pain in their lifetime, but rarely are they going to think about the pelvic floor as being a contributor. Remember, we talked about how the pelvic floor is a group of 14 muscles? Well, 2 of them come through the pelvis and have direct attachments at the hip. And if there are any problems with these 2 muscles, including the other muscles of the pelvic floor, then they can actually affect the way that hip moves, functions, and coordinates with all the other muscles that have attachments at the hip and pelvis and the low back as well. Number 5, pain with sex. Pelvic floor muscles line the bottom part of the pelvis, and they go through the vaginal area as well as the vulvar area. And so if there's any restrictions or tightness that ends up developing in these muscles, then they can restrict things from going in and coming out. So people may experience pain with intercourse. They may also experience pain with gynecologic exams, as well as use of a tampon. So if you are experiencing any sort of pain with sex, whether it's right on entry or even a deeper type pain, then these muscles could be a significant part of the problem. Number 6, erectile dysfunction and genital pain in men. When we look at the male anatomy, the pelvic floor has deep connections inside of the pelvis, but it also has superficial connections to the base of the penis. And if there are any imbalances in these muscles that are more superficial to the base, then they can end up interfering with things like an erection, ejaculation, the ability to maintain an erection, and also potentially premature ejaculation issues. And if any of the deeper pelvic floor muscles or these superficial pelvic floor muscles have any sort of spasms or tightness that ends up developing, then they can end up leading to things like scrotal pain, testicular pain, or tip of the penis pain, or even pain and pressure that feels like a golf ball in the rectum or right behind the prostate. Number 7, tailbone pain. Most people associate having tailbone pain with a fall or some sort of trauma. And while this is true, many people can develop tailbone pain for no reason. And so I'm going to explain to you why both could potentially happen. Remember, we talked about how the pelvic floor has attachments in and around the pelvis. One particular part that it has attachments to is the tailbone and the base of that tailbone. If you have any sort of injury, say you have a fall or birthing trauma or something else, these muscles can actually end up becoming spasmed and tight. tight, which can end up leading to continued tailbone pain, even though it seems that the tailbone has healed. Or for some people, just sitting for excess periods of time or possibly developing tension in these pelvic floor muscles for other reasons can actually end up referring pain into the tailbone. And when that happens, it's not the tailbone that's the actual problem, it's the physical part of these muscles that have gone into spasm and need treatment. Number 8, unexplained lower abdominal pain. Perhaps you've already gone to your general doctor, to a gynecologist or urologist, and maybe even a specialist such as a GI doctor, but nobody can find anything particularly wrong. What could happen is the muscles of the pelvic floor may be to blame. Tightness that can develop in the pelvic floor muscles due to a host of reasons can actually end up referring pain into the lower abdomen, and it can cause everything from deep cramping to sharp pain to even pain that makes it feel like for women that their menses are out of control. And so if you're finding yourself dealing with unexplained lower abdominal pain, then you may want to think about the pelvic floor as being the culprit. Number 9, pelvic pain and pressure. Pelvic floor muscles are notorious for becoming tight. And when they become tight, they can form spasms in and around any of those pelvic floor muscles. And those spasms can cause compression and restrictions around blood vessels, disturbing the blood flow and nutrition that goes into these muscles, as well as cause compression around the nerves that go through this pelvic area, therefore contributing to pelvic pain and pressure. Now that you understand what your pelvic floor issues might be and you're ready to get long-term relief, then check out my secrets to a pain-free pelvic floor.